Hey Leah, how are you?
Fine, and you?
I'm very well, thank you. Do you want to come up? We'll get started. Hi everyone, my name is Dr. Bisma. I'm an aesthetic doctor and hair transplant surgeon working at Dr. Ducu London. Now I joined the Dr. Ducu team a couple of years ago. I think it's coming up to 3 years now. And I moved into aesthetics after working in the NHS for a while, so I was working in healthcare. I was kind of on the fence always about going into cosmetics. I think the main reason why I was first drawn to it initially, actually funny enough, is because I actually wanted to undergo a bit of a transformation for myself. So I was looking at all of these procedures and how they're done. And at one point it kind of became a bit interesting because I saw all these transformations that people were undergoing, how much happier they were coming out of them. And I thought, you know what, I would really like to be able to implement that same change for people as well, to make a real difference in their lives, and also to do it with the best of my knowledge. So that's how I came to join Dr. Ducu and the team, and I've been here ever since, and I really love it. Today we're starting off with a hair transplant touch-up. Leah's been with us before, so I think we're just going to check her hair transplant and then take it from there. So when patients come in, we normally start off by doing a consultation. This is mainly just to understand their medical history first of all, make sure that there's been no changes, they're not taking any new medications that might be contraindicated in these cases, and then we can kind of discuss what they're looking to do on the day, and then how we can achieve those kind of results. So how my day goes, I arrive into clinic. If I have a little bit of time before, I go and get myself some caffeine, so either some coffee or some matcha. And then once I've arrived at clinic, I get changed and I have a look at the schedule. On my schedule, normally, depending from day to day, it usually is vastly different. So I can be seeing anywhere between 2 to 6 patients per day, dependent on the procedures that they're doing. Once I've had a look, then I will prepare my room with my technicians, and then we will get started by seeing the patients one by one. We start off every day with each patient doing a consultation when they come in, just to ensure that we're up to date with their medical history. They haven't had any changes, they're not using any new medications or any new topical creams that might interfere or contraindicate the procedure. Once we've checked everything off there, then we discuss a little bit about the patient's ideas, expectations and concerns regarding the procedure. I'll talk to them a little bit about what they need to know in terms of the treatment plan that we're going to decide with them, and once we've decided on a really good treatment plan, then we will discuss side effects, risks and everything else that they need to know in terms of aftercare. This is how we ensure that we keep the infection rates as low as possible, because with most of the cosmetic and surgical procedures, the biggest risk really comes with infection. Yeah. I really feel that our patients are one of my favorite things about this job in itself, because you see people, different people from all over the place. Luckily we have patients that come to us from abroad, so we see a variety of patients from day to day. And again, we have patients that come in that are really super confident. They've done lots of procedures before. They're not really afraid of anything and are ready to go get in there. They know what they want to get done. They've kind of got an idea from before. But then you also see these other patients that are just starting on their transformations and their journeys when it comes to cosmetics. So for them, they can be slightly a bit more nervous or not too sure about it, or sometimes they come in and they have a bit of a conversation with me and I can see that they're still a bit on the fence about doing things. So I never really push procedures. It's never been my thing to push procedures onto anyone. I really just like to talk to the person and get to know who they are really truly and deeply who they are, why they've come to us, what they really want from the procedure. Sometimes it can be like small things that can make such a huge impact on people's day-to-day lives, like their quality of life can improve drastically. And that's what I just kind of want to understand. Other people, they come in not looking for a transformation, but they do this as a little bit of self-care for themselves. So you get to understand each person, you get to understand their livelihoods, what they're doing at the moment, and it really feels like you're creating a really good rapport and connection with the patients that come in. So when they do come in next time, I'm always asking them questions about where they've gone on holiday and where they're going on next. So it feels like you're just seeing a friend all over again, really, and I really like that aspect of the job. Yeah. Looking forward in my career, I would really like to be someone that champions education and patient safety, as we do through our Dr. Ducu Academy as well. I want to be able to continue being that knowledge source for plenty of practitioners, both the ones that are starting out and also those that are looking to expand on their knowledge base as well, because I feel like this is something that I've always been really passionate about when it comes to learning and education since I was quite young. And I really look to be someone that people can look up to as a mentor, as I've also really seen like the difference that having a mentor, a really good person that can give you their knowledge can be, especially when it came to joining this clinic. Dr. Ducu was a really good mentor to me, and I feel like I wouldn't have grown as well as I did without his help, really.